Hello and welcome to this video on risk calculations. This video contains a lot of very important concepts. It's a part of our series on epidemiology and biostats. My name is Dr. Wahab Fazal and let's get into it. So for any biostats calculation, for most biostats calculation, you need to know this 2 by 2 table. So what is a 2 by 2 table? This is two very important components. One, the columns. The columns are either outcome positive, there's an outcome positive column and there's an outcome negative column. Similarly, there is an exposure positive column and there is an exposure negative column. If you watched our previous video, you know that every disease, every hypothesis, every research hypothesis has usually something called a exposure and then an outcome. Exposure is the causative agent, exposure is the intervention that we want to study, and outcome is either the disease or basically the result that we want or the end point that we're looking on. And if we take the example of lung cancer and smoking, so lung cancer is the outcome and exposure is smoking. So let's take a look at this table. So what is A in this part? So A are people who are exposure positive and outcome positive. B, people who have the exposure but did not develop the outcome. C, people who did not have the exposure, so people who did not smoke but still developed lung cancer. That's C. And then you have this part, which is outcome negative and exposure negative. People who do not smoke, do not develop lung cancer. Similarly, very healthy people. So let's get into this. The first thing that we're going to talk about is odds ratio. So usually I put my questions in my videos towards the end, but in the calculations videos, you will find that I will integrate the questions into the video itself, into the slides itself. So you understand and you evaluate yourself while you're going through the video and you practice a lot. So let's take this example. Scientists are studying a new carcinogen that causes patients to develop lung cancer. In a total population of 5,000 people, 2,500 were exposed to this new carcinogen in the water supply. In these 2,500, 1,500 developed the disease. So 2,500 were exposed and 1,500 developed the outcome. In the remaining 2,500 unexposed, only 500 developed disease. Calculate the relevant risk calculations. First of all, we need to understand what type of study this is. So let's look at it. So they're studying a new carcinogen that causes patients to develop lung cancer. So basically you can say that they looked at the people who have the disease. They did not follow these people up. I know I did not explicitly mention here whether this is a cohort study or a case control study. For the purposes of this question, just remember that this is a case control study. A case control study. Just look at the O. Whenever you have an O in a case control study, the second last word, it's a case control study. You do something called an odds ratio. So let's draw something I call a 3 by 2 table. This is what I call a 3 by 2 table. For the purposes of solving questions in your exam, you need to draw something called a 3 by 2 table. Now I'm going to take a second to pause here and see if you can make this table. Okay, so now let us draw this table together. First of all, I need you to think of the total exposed and the unexposed people. So the total exposed people were 2,500 and similarly the total unexposed people were also 2,500. 2,500 and 2,500. Okay, so of the total exposed people, 1,500 people developed this disease. So exposure positive and outcome positive. So these are 1,500 people. That leaves a remaining of 1,000 from this 2,500. So you have this. Similarly, if you look at the unexposed population, look at this. In the remaining 2,500 unexposed population, only 500 developed the disease. So these are outcome positive people. So 500 developed the outcome, which leaves a remaining of 2,000. So you have this beautiful 3 by 2 table. For the purposes of your exam, you make these 3 columns and 2 rows. Okay, so now let us solve what we call an odds ratio. For a case control study, I said this, if you remember the second last word of a case control study, you know that the risk quantification thing that you use is an odds ratio. Just remember the second last word is an O, case control, and odds ratio. Okay, so I don't have any great way of making you remember the formula for odds ratio. How I remember the formula for odds ratio is that just works in cross. This works in cross, and then I just remembered this formula, just AD over BC is what I remember. That you multiply these things in cross and this works AD over BC. This is odds ratio. So now let us solve for So solving our previous example, you can take a look at this. This is how you write it down. AD over BC. So 1500 cross 2000, this is the numerator, and 500 cross 1000, which is your denominator. Just remember the formula AD over BC and you multiply in cross for odds ratio. Cross for odds ratio, second last word of case control study is an O. So whenever you have a case control study, you get odds ratio. Now let's talk about risk ratio. This is relatively more complicated, as the word says, relative risk, but I think we can make it pretty simple. Let's understand this with the help of an example as well. A study is conducted to determine the association between pesticide exposure and the development of specific respiratory illness among farmers. Researchers categorized the participants into two groups: those who were exposed to pesticides, this is the exposed group, and those who were not, non-exposed group. They follow the participants up for 20 years. They follow the participants up. Do you understand? Whenever we are, if you have watched our previous video, you know that whenever we were following patients, that's a prospective cohort study. So this is a cohort study. The results are as follows. So this is the exposed group. I'm going to leave the numbers for now. This is the unexposed group. And let's draw, I think we can draw the table now. So calculate the risk of developing the respiratory illness among pesticides exposed farmers compared to non-exposed farmers. So first of all, as we talked about, this is a prospective cohort study. And what's the second last word of cohort? It's an R. Therefore, you remember for a cohort study, you need to calculate risk ratio. And for us to calculate risk ratio, we need to draw that 3x2 table, my 3x2 table that we talked about. So these are the options that they've given us. Let's forget about the options, just copy these numbers to the next part, and let's copy these numbers here and let us draw the 3x2 table. So again, our exposed group has 300 people, okay, and our unexposed group has 200 people. Great, that makes a lot of sense. 90 people developed the respiratory illness. That's A, 90 people developed the respiratory illness, and that leaves a remaining of, I think if you minus 90 from 300, that leaves 210. So that leaves 210. So from 230, so this leaves 30 developed the respiratory illness. So 30 are outcome positive. So 30 are outcome positive, and which leaves a remaining of 170. Very, very simple. Now you have everything laid out. Just put in the formula and things will work like magic. So the problem that most students do while calculating risk ratio, and I want to say this first, an odds ratio, is that they try to remember things in columns and rows. Columns and rows do not work unless you know how to draw this table. In this whole video, every question, every example, you should take a minute to pause, and before I get into it, you should try to draw this whole thing by yourself. You should draw this whole thing by yourself. See if you can do it. And then we put in the formula together. So again, outcome positive, exposure positive. This is our chart again. What's the formula for risk ratio? Well, the formula for risk ratio is the risk of outcome among the total exposed divided by risk of outcome among the total unexposed. What does this even mean? Risk of outcome among the total exposed. So let's look at the exposed now. These are people who are exposed. If you talk about the total exposed, this will be A plus B. And risk of outcome meaning people who developed the outcome from A plus B. So you can say that A develops the outcome from A plus B. So if you write this down, this comes up to be A over A plus B. Let's talk about this again. People who were exposed and developed the outcome from the total exposed. So this is the risk of outcome among the total exposed. And how you write it down mathematically is A over A plus B. Similarly, risk of outcome among the total unexposed. These are the people who developed the outcome but were not exposed. So C over C plus D. So C over C plus D. So if we take our previous example and we try to put in this equation for risk ratio, so here it goes. This was our previous example. This is all of the values that we put in. And this is the formula for risk ratio. A over A plus B. This is the risk of outcome among the exposed divided by the risk of outcome among the total unexposed. So total exposed, total unexposed. If we put all the values here, this comes up to be 90 A over A plus B, which is 300, 30, which is C over C plus D, which is 200. And this value comes up to be 2. This comes up to be 2. Remember, cohort, second last word is an R, so you remember risk ratio. Case control, second last word is an O, so you remember odds ratio. So for us to solve our previous example, let's look at all the options, and we know that the correct option here is 2.0. Correct option here is 2.0. That is the correct option. You know the risk ratio formula now. Risk of developing the outcome among the total exposed divided by risk of developing the outcome among the total unexposed. That is in fact risk ratio. It makes sense. The name makes sense now. Risk ratio. It's a ratio of the risks between the two groups. And I want you to remember these two formulas, A over A plus B and C over C plus D. This is very important because what we're going to talk about the future is going to relate to this. Then risk and odds ratio interpretation. How do you interpret the values of these? I need you to focus on the word ratio here. Remember that these are ratios. How do ratios work? Well, when you talk about ratios, ratios usually have a numerator and a denominator. They work in fractions. They work in fractions. When in a fraction do you get the value of 1? Well, you get the value of 1 when both the numerator and the denominator are equal. So, whenever risk ratio or odds ratio comes up to be 1, that means the risk in the exposed group and the unexposed group is exactly equal. That means both of the groups are basically the same. There is no added risk. So, similarly, odds ratio also has a numerator and a denominator. What does that mean? That means whenever you get the value of 1 in both of these ratios, it's insignificant. It's insignificant. Whenever you get value greater than 1, that means that the risk in the exposed group is greater. That means the risk in the exposed, whatever group was exposed, this is the exposed group. That means the risk in the top group is greater. This group was exposed to carcinogen, toxin, or whatever we talk about. Similarly, when the value is less than 1, that means that the risk in the exposed group is actually less. That means that the risk in this group is actually less. How is that possible? How is that possible? This is possible when the exposure is somehow protecting you from developing the outcome. The exposure is somehow protecting you. This can be a drug, this can be a medication, this can be a mask, this can be some sort of intervention that we are trying to experiment that is somehow reducing the outcome development in the exposed group. So that's when the risk in the exposed group is lesser. That's less than 1. This is risk ratio and odds ratio interpretation. Now let us talk about a concept that really bothers and confuses people for no reason in particular. This is a concept that confused me a lot, and now when I look back at it, and after watching this video, you will also say this. You will say that this is probably the easiest concept of this whole video. So let's talk about absolute risk reduction and attributable risk. What is attributable risk? Both of these values are actually pretty much the same. Both of these values have the same definition. They're the difference in risk. They're the difference in risk between the two groups. How is this possible? How could both of these two different concepts have the same definition? First of all, I want you to remember the formula for the exposed group, for the risk in the exposed group, which is A over A plus B, total exposed, and the risk in the exposed. Okay, this is the risk of developing the outcome in the exposed and the risk of developing the outcome in the unexposed, C over C plus D. So you might be wondering, how does this work? Let's take the help of a simple illustration. Let's talk about attributable risk now. Same definition, again I've written this down, difference in risk between the two groups. When we talk about attributable risk, this is the risk in exposed group. Let's take this box to be a representative of the risk in exposed group. Let's say this is the risk in exposed group. This is the risk in unexposed group. Okay, that makes sense. So how about we talk about the difference between these two boxes? If we draw a line here, this added amount of risk, one can say, is due to this exposure. You can say this. You can say that both of these groups are very similar. There was just only one difference. There was only one difference between the two things, and that was, let's say in this case, smoking or toxin or carcinogen, whatever the difference. This is causing this added risk of developing this outcome. This added risk of developing this outcome. This is due to the toxin. So whenever there is a toxin, whenever there is a carcinogen, whenever there is something harmful, whenever there is something harmful, we talk about something called attributable risk. This extra difference becomes attributable risk whenever you have a toxin, whenever you have carcinogen. And similarly, same thing, if you have a medication, the risk in the exposed group, whoever the risk in, let's say the risk in the treated group, whoever got the medication is now lesser. This is now lesser. Same thing, just you switch them up. The same thing is now called, this is the risk in treated group, this is the risk in untreated group, and this difference right here is now called ARR. This difference right here is called ARR, or absolute risk reduction. The risk that is now reduced in the treatment group due to the treatment, due to the medication, is called ARR. Both of these values are exactly the same. Their formulas are the same, just these groups are switched up. Now let us look at the formulas and the differences between the two. If you haven't understood this till this point now, you'll understand it now how to at least do the questions. Let's take a look at the differences. Attributable risk and absolute risk reduction. Attributable risk talks about toxin, carcinogen, viruses. Absolute risk reduction talks about drug and treatment. And whenever you have a drug or a treatment, just know that the risk in the exposed group or the risk in the treated group, people who got the medication, is less for developing the outcome, or should be less for developing the outcome if your medication is working. So if you're looking in your group, if you're looking in your book, you will see these formulas. And these formulas are okay, they make a lot of sense. If you understand this, fine, that's great. But I'm going to give you a very simple trick. Forget about these two formulas. Write the same thing again. Just remember this trick. Keep the bigger risk box earlier in the subtraction. Whenever you get the question for either to calculate attributable risk or the absolute risk reduction, just try to find out which group has a bigger risk of developing the outcome. And when you're trying to write the equation, you know what to subtract what from, just write it earlier in the equation. Let's take an example of this to understand this better. You're going to solve these questions like this. You're going to solve these questions like butter. This will be the easiest question in the whole biostats questionnaire. So let's take this example. A group of researchers is trying to study the relationship between smoking and the development of chronic cough in a population of factory workers. The study divides the workers in two groups, smokers and non-smokers, so exposed and non-exposed. The results of the study are as follows. Let's skip the numbers for now. What is the attributable risk of chronic cough associated with smoking in this population? And I think we're going to have the options now. First of all, let's do it again. Every time you get a question like this, draw the 3x2 table that we talked about, not the 2x2 table. Dr. Wahab told you, draw the 3x2 table. So let's draw the 3x2 table. And first of all, pause the video here, see if you can draw the 3x2 table by yourself, and then we're going to do it together. Okay, let's do it together and see if you did it right or not. So the total smokers or the exposure positive are 200 people. So these are people who got the exposure positive, 80 of whom developed the chronic cough. Okay, 80 of whom developed the chronic cough. 300 non-smokers, 300 exposure negative. Okay. 80 develop chronic cough, that leaves from 200, that leaves a remaining of 120. So that leaves our B to be 120. 300 non-smokers, 300 exposure negative people, 30 of whom developed chronic cough. So 30 will come here, 30 comes here, and 270 are left. So we have this beautiful table now. Okay, so now that we have this beautiful table, what do we have to do? First of all, you need to think in your mind, is the risk in the exposed group going to be greater than the unexposed group? is this a toxin or a carcinogen? Well, yes, smoking is a toxin, right? If it's a toxin, then the thing that we're going to calculate is called attributable risk. So what do we put in the equation first? The exposure positive group first, because the risk in this group is going to be higher than the unexposed group. If you were to calculate this, just put this in the equation first and minus the smaller thing from it. Let's calculate it. We put the box up. Smoking group minus non-smoking group risk. So 80 over 200, 80 over 200 and 30 over 300, which comes up to be 0.3. This is the attributable risk. Whenever you have a toxin, whenever you have a carcinogen, whenever you have something bad that causes you to develop the outcome, just keep the bad thing first, keep the non-exposed group later, minus this, and you get the attributable risk. Now let us take the example of absolute risk reduction. So if we were to talk about the same question, what is the answer to this question? What is the closest answer to this question? It's 0.28. If you're wondering why I did not write 0.3, because that's how tough exams work. They don't put the exact value, they just put something close to it, and that is the answer. Let's talk about absolute risk reduction. Let's take an example for absolute risk reduction before we move on to something else, because I want you to understand this. A clinical trial evaluates the effectiveness of new medication in preventing heart attacks in high-risk patients. The trial results are as follows. So this is an intervention. This is a new medication. What are we talking about? We're talking about absolute risk reduction. That makes a lot of sense. The treatment group, let's leave the numbers for now. What do they want us to calculate? They want us to calculate the absolute risk reduction associated with the new medication. And these are the options. First of all, I want you to pause the video here. See if you can make this 3x2 table. Okay, so let us draw this together. So first of all, let's write the total exposure positive people. These are people who got the treatment. So 1000 in total, 1000, okay, and 1000 people who did not get the treatment. This is the control. If you've seen our clinical trials video, you know what is treatment group, you know what is control group, and how a clinical trial works exactly. So 1000 people here. 50 people in the exposed group, in the treatment group, developed the disease. They experienced a heart attack. So 50 people here developed the heart attack. What does that leave us with? That leaves us with 950 people who did not get a heart attack. They got the medication and they did not get a heart attack. Great. In the control group, 150 people experienced a heart attack. So a greater number of people got a heart attack. 150 people. And then 850 people did not. 850. That leaves us with 850 people. Now take a look at this table now. Which group do you think has a greater risk of getting a heart attack? In this group, only 50 people got heart attack among 1000. And in this group, 150 people got a heart attack among 1000. That means this group is bigger. People who did not get the medication had a greater risk of getting a heart attack. So you keep this group first. You keep this bigger box first in this equation, and then you get what we call the absolute risk reduction. It's that simple. You just keep 150 by 1000 first, and you subtract 50 by 1000 from it. So you 150 by 1000, this comes first. You subtract 50 by 1000 and you get 0.1. This is the absolute risk reduction. It's that easy. Just keep the bigger risk thing, the bigger risk group in the equation first. If it's a treatment, if it's a medication, the value that you get will be called an absolute risk reduction. If it's a toxin, if it's a carcinogen, the value that you get will be called attributable risk. They're basically the same thing, but they're used for different purposes. So they're called two very different things. And when you read about it, you're like, what is this? It's just this simple. It's that easy. I wish somebody has explained this to me while I was doing my step preparations this easy, because I spent a lot of time worried about this concept. Let's move on. So if we take our previous example and now solve it, So this comes up to be 0.1. Now I've made this exercise for you to understand this concept even more, even better by practicing it a little bit. We'll take different groups. I want you to think of the equation for either attributable risk. First of all, I want you to think, is this an equation about attributable risk or absolute risk reduction? Then I want you to think what the formula is going to be. Which group will come first in the equation? So smokers versus non-smokers, which group will come first? I think the smokers should come first, because the risk in smokers for developing, let's say, I don't know, this should be lung cancer written here. So if we think of, let's say, lung cancer, smokers' risk of lung cancer is higher. So you write lung cancer risk in smokers is higher versus non-smoker, and this will be in fact attributable risk. This will be attributable risk. Let's take this next example. Let's take the example of sugar consumption and developing diabetic ketoacidosis. So people who have higher sugar consumption versus lower sugar consumption. Think of whether this will be an attributable risk or absolute risk reduction. And whatever this is going to be, how do you write the equation? So this is how you write the equation. Increased sugar consumption, people who have increased sugar consumption minus normal sugar consumption, meaning this is going to be an attributable risk, because increased sugar consumption has a higher risk of developing diabetic ketoacidosis. If you consume sugar more, it's bad for you. It's kind of like a toxin. It's a bad thing. MI risk in exercise versus inactive people. This is a smart question. Let's take a minute here. Okay, so what does exercise do? Exercise reduces your risk of developing MI. Exercise is kind of like a medication. It's an intervention. And whenever you have an intervention, what do you call the difference in risk? You call it ARR. You call it absolute risk reduction. You want to know the risk that is reduced by exercise, right? And then you minus inactive people minus the exercise people, because the risk in inactive people of developing an MI is always going to be higher than the risk in exercise people. So therefore, this is what you call an absolute risk reduction. What is attributable risk percentage? This is a very simple concept, and I'm not going to spend a lot of time on it. Just if you understand the concept of attributable risk, this is very simple for you. So let's get into it. What is attributable risk percentage? It's the same thing. The top part of this equation is the same as attributable risk, meaning the risk in the exposed group minus the risk in the unexposed group. The difference is that you divide this whole thing by the bigger box, by the exposed risk, multiply by 100. So in essence, what attributable risk percentage wants you to tell is, so whatever this person's actual risk for developing the disease was, what percentage of it is caused by this particular toxin? What percentage of the risk is added by this particular toxin? If you take the example of sugar consumption and diabetic ketoacidosis, so if a person has a risk that is this high of developing diabetic ketoacidosis even while having normal sugar consumption, if that person starts taking a larger amount of sugar consumption, this amount of added risk, what percentage does it form of the total? That's simply attributable risk percentage. And how I want you to remember this with the help of the illustration that we drew before. So this is our risk in the exposed group. You minus it by the risk in the unexposed group, and you divide it from the risk in the exposed group again, because you want to know what this forms of the total, what percentage of this is from the total. And just looking at it roughly, I think if this is the half of this picture, I think it forms around 25%. So you can say that 25% of risk in this case was due to the exposure. Remember the equation: attributable risk over the group, over the risk in the exposed group, over the risk in the exposed group, and you just multiply this thing by 100, and you get what you call attributable risk percentage. I'm not going to spend a lot of time on it because I don't think it's the highest yield thing, but you should know this. But you definitely should know this because this is sometimes asked in your exams. Let's take an example: smoking group minus non-smoking group. This is a previous example in which we calculated the attributable risk value. So this came out to be 0.3. Okay, this was our chart for 0.3. This was the table that we drew from that example. So what you do, in fact, again for attributable risk is that you divide the whole thing. You divide the whole thing by the risk in the exposed room, by the risk in the smoking room, which is A over A plus B. So this is 0.3 over 0.4, and you multiply the whole thing by 100. So this comes up to be somewhere around 75%. So you multiply the whole thing by 100, and this comes up to be 75%. Great. That is how attributable risk percentage works. What percent of the risk was actually formed by our exposure? So in the end, let us summarize this whole topic. You make what is called a 3x2 table, meaning 3 columns and 2 rows. You try the total exposed and total unexposed as well, because that helps you solve all of the risk ratio and odds ratio equations. Then case control, look at the second last word is O, so odds ratio, which is, just remember the equation, it works in cross A, D over B, C. Okay. Risk ratio is basically risk in the exposed divided by risk in the unexposed. How did we talk about risk in the exposed? A over A plus B, so total exposed, A over A plus B divided by C over the total unexposed, C over C plus T. A over A plus B divided by C over C plus T. Both of these values are ratios. So in ratios, the value of 1 is insignificant. If the value is greater than 1, then the exposure attacks. That's just the way of remembering. If the value is greater than 1, exposure attack. If the value is lesser than 1, then the exposure protect. Attributable risk is the risk in exposed minus the risk in unexposed, or the absolute risk reduction. These are the formulas: placebo minus the risk in exposed. Or what you could do is that you could forget both of these formulas and just keep the bigger one earlier in the equation. If the intervention is a medication, if the intervention is something that helps reduce the risk of developing the outcome, that's an absolute risk reduction. If you're talking about exercise, if you're talking about medication, if you're talking about something that reduces, if you're talking about wearing a mask, that's an intervention that reduces the risk of developing, let's say, corona, then that is called an absolute risk reduction. And the same value, if you're talking about a toxin, if you're talking about a carcinogen, is called attributable risk. Attributable risk percentage, just calculate attributable risk and divide it by the bigger risk box and multiply the whole thing by 100, and you get what you call an attributable risk percentage. In the end, thank you so much for watching this video, and I know it's a long way, but sometimes you need to just look back and look how far you've come now. Thank you, and stay tuned. Watch our next video on epidemiology and biostats.